This help comes at a critical time for Southeast Texas. As you can see, we've seen such a sharp increase in hospitalizations. We have 224 COVID patients in Jefferson County hospital beds tonight, down slightly since yesterday, but it is still among the highest numbers we've seen during the entire pandemic. So how much worse will this surge get? Doctors are tired and burned out.
Yeah, some say a spike in cases could have been prevented. 12 News reporter Amelia White sat down with 2 health officials today to chat about what we could be bracing for.
Jordan Dage, this is news we all didn't want to hear with the direction we're heading into with the COVID-19 cases. Doctors say it's going to get worse before it gets better.
These headlines tell the story.
We are getting tired. We are getting burned out. We are getting overworked.
Of the emotions health officials are feeling all over again.
I cry. Me and my coworkers, we cry. When I come home, before I see my family, I have to put my game face on because it's heartbreaking.
COVID-19 nurse practitioner Rolanda Ford says from the start of the pandemic to where we are now is a complete 180.
It's definitely worse. The patients are more critical. The patients are younger. We have shortage in staff. We have shortage in equipment. And it's very scary.
The worst part, Dr. Ray Callis says we're still waiting to reach our peak in cases.
We're looking at the peak being sometime the 2nd or 3rd week in September.
Southeast Texas broke a record number in COVID-19 cases this week. In one single day, 644 cases were reported.
I would tell you that if I was a betting man, I would bet that the death toll will probably be higher.
A prediction Dr. Ray Callis foresees in the upcoming weeks.
Unvaccinated is going to continue to cause the problem until we decide to come together as a state and as a community.
As Ford cares for her patients, she says she's constantly a listening ear for their regret.
Wish I would have gotten vaccinated. I hear that every day.